Namaskaram, sir.
Namaskaram.
I am very, very pleased to introduce to you Mr. Balasubramanian, who is now just turned 81 years of age. Today he has come for a 8-year follow-up visit after stem cell treatment to the left knee 8 years ago in June 2016. A few months before that, he had undergone a right knee replacement, but then for the left knee, he chose to have a stem cell treatment, and he is one of the longest follow-ups which I have of 8 years after bone marrow stem cell treatment. There's one more gentleman, and now since face-to-face account is better than any jargon in scientific literature, I decided to request him to narrate his experience and let the viewers know how he is faring. Namaskaram, sir. Thanks for coming. MJRC, how are you do?
Fine, sir.
So tell us about yourself. You are Mr. Balasubramanian.
I am Balasubramanian.
How old are you, sir?
I am 81 years old.
What is your weight?
Weight is now 48 kg.
Okay. So you are very active.
Yeah, very active.
Every
day I walk.
You walk every day.
Every
You
day
go
I
to the
walk.
temple.
Yeah.
You go to the temple.
I go to the temple during the Dhanur Masam.
And then you squat on the floor.
Yeah, squat on the
sit cross-legged.
Sit cross-legged.
How many
chant
every
mantra.
day almost chant the Vedas.
Chant the Vedas every day. We go at 5 o'clock in the morning after chanting and also reciting the slokas of Vishnu Sahasranamam and Lalita Sahasranamam, Lakshmi Stotram, etc. We come back home every day around 7:30. So 2.5 hours.
You are able to squat on the floor.
Yes.
No pain.
No pain.
How much can you walk?
I walk around two-way around 5 miles.
5 miles a day.
5 miles a day.
Do you have any pain while walking?
No. If I don't walk only, I have pain.
Okay. Do you have any swelling in the knee?
No. Nothing.
Nothing. You can climb stairs easily?
Yes, easily.
No problem?
Every day I climb three floors.
Do you have any pain on a daily basis?
No.
Then are you taking any painkillers? Because you have no pain, you need to know.
I don't take anything.
You're not having any diabetes, blood pressure?
Only
nothing.
BP is there.
BP is
for
there.
that I am taking medicine in the morning, also in the evening. One amlodipine and 5 mg, and also this telmisartan 80 mg. That 40 in the morning and 40 in the evening, like that. Nothing else.
Nothing else. Nothing else.
So here, only when I don't walk, I have pain in the legs.
So it's very good, important to keep active.
Yeah.
And you will have, of course, you will suggest to people that they should remain active and walk as much as possible.
Yes. Walk as much as possible, because we should not remain idle in a place. Otherwise, we will be having a lot of problems with the legs and all that, even joints everywhere.
So thanks for coming, sir,
Yes,
and
sir.
narrating and putting on record your pain relief, continuing pain relief after 8 years.
Yes.
So it's very, very heartening and encouraging for me and for you and anybody listening to this story that this procedure is indeed succeeding. I did bone marrow stem cells for you, and now I have switched over to fat within a couple of years after your treatment. And the gentleman we are going to speak to next is an example of that. We will also listen to his story next. Thanks for coming, sir. I wish you bon voyage in your next trip to America, which is upcoming next week. Thanks for coming, sir.
Thank you.
Namaskaram.
Thank you. Namaskaram.